So now we're moving on to the second issue for today. Like we talked about earlier, this discussion is about direct-to-consumer pharmaceutical advertising and its impact on patient outcomes. Team A is representing the pro position, meaning they are in support of direct-to-consumer pharmaceutical advertising and its impact on patient outcomes. Team B is representing the con or opposition position on this issue. So at this time, we'll ask Team A to have their opening statement. They have 2 minutes.
Good morning. My name is Nandini Razan, and I am a medical student from Philadelphia College of Osteopathic Medicine. Today, my teammate and I will be arguing the pro for direct-to-consumer advertising. Direct-to-consumer advertising began as a form of social justice and continues to empower Americans to take control of their health. DTC, direct-to-consumer advertising, began during the 1980s following the patient rights movement, which was aimed at requiring health professionals to provide patients with more information about their treatment options. Since that social movement, consumer-oriented medicine has become the trend in medicine. Consumer-oriented medicine gives individuals more responsibility for their health and healthcare and promotes shared decision-making between doctors and patients. Direct-to-consumer advertising is a legitimate form of providing patient information that empowers patients to take ownership of their health. Currently, 7 out of 10 Americans take prescription drugs, at least one prescription drug. Therefore, it is more important to expand health education to patients rather than to isolate it only to when they enter a physician's office. We argue that direct-to-consumer ads have a positive effect on patient outcomes because it appeals to our medical ethics, particularly patient autonomy and justice. Additionally, there are numerous guidelines already in place to ensure that unbiased patient education on the product. Finally, as a room full of healthcare providers committed to humanitarianism, we can all appreciate the importance of money and savings. Direct-to-consumer advertising actually has a positive effect on the market and allows savings for patients. While we agree that regulations of ads may be improved upon, we argue that benefits of promoting the ethical principles of autonomy and justice and increasing market competition while still leaving the final prescribing power to physicians outweigh any potential deleterious effects that may be speculated. Thank you.
Team B, I go ahead and invite you guys to give your opening statement. You have 2 minutes.
Good morning. Thank you for allowing us to participate in this productive discourse on a topic that undoubtedly affects the practice of every physician. We come here today to argue that direct-to-consumer drug advertisements, or DTC ads, have a negative impact on patient outcomes. Before we continue, we'd like to address the wording of this topic. Our question today is whether patient outcomes are positively impacted by these ads. But since there's lack of credible research linking DTC ads to morbidity or mortality, we'd like to approach this debate by linking the patient outcomes to the patient-doctor relationship. With that in mind, our first reason to negate this resolution is as follows. By presenting incomplete and biased information to patients, DTC ads result in financial harm to patients and to the healthcare system as a whole. Pharmaceutical companies are profit-driven entities, and inherently their goal is to sell the product to patients. However, in doing so, DTC advertisements often do not paint a complete picture. Advertisements tend to focus on the most positive qualities of the medication. A study by Mansfield in 2006 reports that 23 DTC advertisements, they spent more time on the benefits than on the risks. And in another study of 320 magazine drug ads, they found that the DTC advertisements rarely included success rates or alternative treatments, such as healthy lifestyle changes. Pharmaceutical companies stand to benefit as this makes their product more attractive to potential buyers and limits the patient's understanding of their treatment options. In addition to employing unsavory techniques in order to maximize sales to their consumers, pharmaceutical companies sell copycat medications that is often quite similar to generic alternatives. This leads to increased cost burdens on both the patient and the healthcare system because there is no real benefit to brand name over generics. DTC advertisements also undermine patient-practitioner relationship. So by maintaining a strong relationship between the patient and the physician, that's
10 seconds.
Quality medicine, and it deteriorates this. Thank you.
Thank you very much, Team B. At this time, we're moving to the question and answer session, which I'll begin. Team A, I know you mentioned the start of direct-to-consumer advertising as something in the interest of patients, something driven by consumers, something that's empowering within the relationship between provider and patient. As you're aware, though, in the 90s, one of the biggest burdens for pharmaceutical companies to get their advertisements on broadcast media were the costs associated with remaining compliant with those regulations. As such, they pushed for deregulations that allowed them to do a little bit less to get their ads on the air. And as a result, we have seen more instances of ads that aren't appropriately listing the risks associated with medications and are often pushing patients to come to their physicians looking for a certain drug. Don't you fear that the pharmaceutical industry has too much influence in how these ads are being produced and that this could potentially have a negative impact on the physician-patient relationship?
So I'd like to just first lay out that the current guidelines that are in place, because there are in fact a few strong guidelines in place. So for broadcast ads, they must meet the adequate provision requirement, which says that the ads must list the most important risks and a link to the official FDA approved prescribing info via either a phone number, a website, or contacting a healthcare professional. And that's a requirement that has to be met. For print ads, they must have a brief summary requirement, which states the risks listed in the official FDA-approved prescribing info pamphlet, and at least one FDA-approved use, and who should take it, when to not take it, serious side effects, and most frequent side effects. And I would argue one of the most important guidelines that are in place is the Fair Balance Law, which says that the content displayed in these ads must fairly be representing the risks and benefits. You cannot make the risks in smaller print. They have to be fairly represented in broadcast as well as print ads.
Thank you. Now, Team B, I know you guys also mentioned the relationship between the physician and the provider and the import that has in healthcare. You guys discussed the way in which these direct-to-consumer ads could potentially be toxic to that relationship. But one thing I didn't hear you guys discuss were the other types of direct-to-consumer drug ads that do exist. Things like reminder ads or drug classification ads. Not an ad about their drug itself to try to market it or to increase its use by patients, but rather a call to action for those in the public who might not be aware of whether or not they need to be more medically compliant or that they have a problem in the first place. And there's good evidence that suggests these reminder ads can actually help people who didn't know they had a problem seek out help from their physician and receive that diagnosis sooner. Don't you think that plays an important role in patient outcomes?
I think those types of advertising definitely play a role, but I would argue that it isn't important. TV ads, magazine ads, and internet ads are a multi-billion-dollar industry, and they comprise the vast majority of advertising. And when we're looking at the effect of advertising on patient outcomes, my argument and our argument is that we should be focusing on the vast majority of advertisement, which is TV and magazine. And when we look at TV, magazine, internet ads, we see that that picture that they paint of the drug that they're trying to sell is often incomplete and biased. And it's because they are a profit-driven entity that don't really want to increase patient outcomes. Rather, their main focus is to increase their bottom line.
Thank you, Team B. This time we invite both teams to ask questions of one another. Team A, you may ask the first question.
So one of the points we have or the questions we have for Team B is, if doctors do have the final prescribing power and the power of sort of setting the ground for a patient-doctor relationship, how can we ascribe the potential deleterious effects that you've speculated on, specifically on direct-to-consumer advertising of prescription drugs to consumers?
So the patient-doctor relationship is symmetrical, it's collaborative, it involves both voices. And if the patient doesn't like what the doctor has to say, the patient finds another doctor, regardless of the relationship in the past. And our argument is that these ads are a disruptive force for the patient-doctor relationship. It gives patients the idea that they're informed, that they know what they need, but in fact it's shrouded with their goal, which is their goal is to sell the drug. Like you said earlier, we want a consumer-oriented medicine. Our argument is we don't want a consumer-oriented medicine, we want patient-oriented patient-oriented medicine. And patient-oriented medicine takes into account potential risks to the patient's individual conditions and whether they should have those medications, and the availability of alternative, less costly generic treatments, which pharmaceuticals are not interested in. So our argument is that we don't have patient-oriented medicine in this relationship. We have a frayed doctor-patient relationship that is disrupted by a consumer-oriented entity.
Thank you, Team B. Team A, you have 30 seconds for further clarification if you'd like on this question.
So yeah, I'd like to clarify my point as well. So we are arguing that the potential positive effects of direct-to-consumer advertising far outweigh the potential fraying of a doctor-patient relationship. We argue that a more informed patient, by way of direct-to-consumer advertising, outweighs the potential effects of having a less informed patient approach a physician and harp back on our ways of paternalistic medicine.
Team B, you may ask your first question.
Okay, our question is, so you laid out an ethical principle. You said that autonomy is truly important in this debate, and we're giving patients autonomy. So our question is that when there's information asymmetry, when there's information that the pharmaceutical company knows and can decide exactly how they want to disseminate that to the public, and when we know that that information depends on whether they believe that it will increase pharmaceutical sales, can we truly say that DTC ads are good for patient autonomy?
So I'd like to I'd bring that point back to the guidelines that I mentioned earlier. Drug companies cannot just say whatever they'd like to on ads. We do have strict laws. We have strict guidelines that, yes, there may be some pushback against, but they are in place, and they say that the Fair Balance Law says that they have to fairly display the risks and benefits of the drug to the consumer. And I'd argue that the positive effects of a more informed patient, of a patient that has more access to healthcare where they otherwise wouldn't. Sometimes patients only access to healthcare maybe through a YouTube ad, and that may prompt them to go seek out help for a potential medical condition. I argue that that far outweighs, the potential effects of a pharmaceutical company trying to push their product.
Team B, any clarification you'd like to add?
So we just wanted to point out the potential upswings that you're emphasizing versus the realities. See, drug advertisements may point customers, or patients we should say, to resources where they can find information about the drugs. However, people are not very likely to get up from their computer screen or from their television to go to this website or call a hotline and find out more detailed information about drugs. So while it's a potential for better patient education, I just don't see it panning out in reality.
Thank you, Team B. I think we have time for one more brief question if Team A has another small question they can ask.
So I would argue that the potential effects that you're citing, is this not the product of just a more informed society in general? People have more access to information on the internet, on WebMD, on various other websites. Is the sort of effects that you're stating of a patient and fraying the patient-doctor relationship, coming in with their own sort of opinions on what drugs they should be taking, is this not just the product of a more informed society? And why shouldn't we regulate that more effectively and still keep the benefits of providing direct-to-consumer information through these drug ads without sort of taking all this away and saying that, that society is not progressing in this way and sort of ignoring what's happening in a broader sense?
We'll give Team B a minute to respond.
I think the main thing to keep in mind here is that we're asking whether DTC ads in their current state, if they have a positive outcome or positive impact on patient outcomes. So we can't argue whether other regulation or other changes might potentially make it better. We're talking about right now, do DTC ads in their current form, do they have a positive impact on patient outcomes? And we're talking about potential benefits of PSAs, potential benefits of telling people, but we don't know about the real benefits. There's been nothing about what is actually happening. On the other hand, if you look at the past in DTC ads, we look at drugs like Vioxx, Orflex, Resolin. These are drugs that were pushed out to the public, millions of dollars in ads spent, and then had to be pulled away by the FDA because they had done so before getting a safety profile picture. And in the course of doing that, put thousands of patients under increased risk for heart attack and stroke. Those are real negative effects that we've had because of DTC ads in their current form, in contrast to those potential benefits.
Thank you, Team B. At this time, we're going to move to the audience Q&A. So like we did before, if you have a question, please feel free to step up to one of the microphones. I'll call on your microphone number. Please go ahead and introduce yourself, state the team that you'd like to ask the question for, and then state your question. Mic 4.
Loretta Opila. My question is, do you think most patients can adequately interpret the ads with equal size being given to the positive and the negative effects? I frequently encounter patients who say they will never take this medication because one of the rarer side effects is listed in their advertising. And that's for side A.
Thank you.
Hi, thank you for your question. The point of the ads is more so to educate the patients on just their symptoms and to seek out advice from their physician, which every single ad, if you, at the end, says, if you feel like you have any of these symptoms or have any more questions, please talk to your physician about it. So no, it is not the job of the ads to ask the patient to diagnose themselves or to assess everything. It is just giving information and encouraging them to talk to their doctor, which is ultimately the job of the physician's role to decide if that patient needs that drug or not.
Go with microphone 1.
Hi, my name is Anna Wang. I'm a medical student from Penn. I have a question for Team B. So you talked about the information asymmetry between pharmaceutical companies and patients, and I wanted to ask you about the information asymmetry between physicians and patients. How would you respond to the criticism that without direct-to-consumer ads, prescribing is entirely based on the biases of the physician and the physician-pharma relationship? How would you respond to that?
Well, I would argue in the sense of a physician-patient relationship, the information there, the physician is upholden by professional standards. The physician is regarded by society as a force for trust, a force for good, somebody that is going to be the patient's advocate. Our argument is that the information that's being disseminated by these pharmaceutical companies, it's not as an advocate for patients. It is an advocate for shareholders for that company. So in the sense of physician bias, there will always be physician bias. Different physicians will have different opinions. But the main problem when we look at it from an ethical perspective is that physicians have an ethical duty to advocate for the patient. Pharmaceutical companies do not have an ethical duty to do so.
Microphone 4.
Yes, I'm Ricardo Morgenstern from Philadelphia. I would like to ask you, what is your opinion on the pharmaceutical industry marketing for very expensive new medications and not educating with the most common medications that are sold for most of the people?
Is this directed to which team?
Both of them, because
Both
it's
teams.
positive and negative points.
Okay.
Yes.
So is the question about the marketing of new drugs?
Yeah, why they're marketing the medications and not educating with the most common used medication?
So, I agree that there is sort of an imbalance. that a drug company may not necessarily be marketing what is used most frequently clinically, but I see that I would argue that that's sort of not their aim. Their aim is to promote their new product, and in doing so, share it with the public and provide free, open access medical education, or not specifically medical education, but healthcare information to a patient population who can then say, I think I have one of these symptoms, and then seek out additional help. And that may be their first foray into seeking healthcare in general. And while they may not end up having the serious illness that, or the very rare illness that is treated by that drug, it will bring them to a healthcare professional who can, then address and say that, hey, you know you don't have lupus, or no, you don't have this disease, but you do have hypertension, and there are drugs that can help you there as well. And it may not be this drug, but thank you for coming in and thank you for being informed. And I think that's their benefit.
Team B, your response to the question?
Thank you. So you brought up the advertisements that are just reminding and help seeking, which those are two types of direct-to-consumer advertisements. However, product claim ads are the ones that the question is specifically focusing on. And these advertisements focus on getting a product out there and to the most amount of people. So whenever you have an industry that's interest is to sell a product, then you're putting undue influence on a patient to bring these influences from their television set into the doctor's office. And the patients often will come into the physician and they're asking about specific medications. And like you said,
10 seconds.
If there may be a better medication available, it might not be a blockbuster, but the physician will know about that. And if the patient can't see that because they've been blinded by the advertisements, then that's problematic for the physician to deal with.
Thank you, Team B.
Thank
you. Microphone 3.
A question for Team A. The pharmaceutical industry spends billions and billions of dollars every year on advertisements, the glitzy ads on TV. Aren't you concerned that DTC advertising is increasing the cost of medical care in our country?
I assume that question is for Team A?
Yes, I said Team A, yes.
Thank you.
So I would argue that the competition that it brings about in the marketplace by having drug companies sort of compete publicly for their product drives down drug prices in certain instances. I also want to sort of introduce the point that the majority of marketing, the majority of the money that pharmaceutical industries spend on marketing is marketing towards physicians. While they do spend a good amount on direct-to-consumer advertising, the majority of it is towards physicians, and perhaps that's where we can begin to chip away at some of the medical costs that, or the rising medical costs that this contributes to.
Thank you. And again, unfortunately, we need to move on to the next section. So once again, if you weren't able to ask your question, please feel free to seek us out afterwards. We'd love to hear your insights on these issues. At this time, we're moving on to the closing statements. We'll give Team B 60 seconds for their closing remarks.
When thinking about this debate, I think we really have to frame it as ideals versus realities. Team A tells you that there's regulation, there's FDA regulation to prevent benefits versus risks from being biased. In fact, we'd like to extend what we said at the beginning, a Mansfield 2006 study showing that they do spend more time on benefits than risks. That is define that regulation of the FDA. In addition to that, there are ways of getting around that regulation. We always see DTC ads showing people playing, puppies playing, people having a good time while they're saying all these risks. That's just another way to get around this regulation that's saying you need to let consumers know the full picture. They have no desire to show consumers the full picture. They want to show consumers a happy drug, a drug that will help them, a drug that they can sell. In addition to that, the Team A talks about potentially helping patients through education. The fact is we've shown you the financial harm by promoting drugs that are just that are equally as effective as generic drugs but much more expensive. We've shown you unsafe drugs that had to be pulled from the market because of the exuberance that these companies have to sell them to patients. And we've seen a lot of harms to patients. Thank you.
Team A, you have 60 seconds.
So I think when we compare ideals versus reality, I think in terms of the positive, or in terms of the effects of direct consumer marketing, I think appeal, I don't think there's, I'm sorry, let me start over. I think that physicians, in general, I think we are a profession that appeals to our highest ideals and our highest sort of moral principles, and I think that the positive effects of direct-to-consumer advertising on our dearly held beliefs in medical ethics of patient autonomy and patient justice, I think that far outweighs the potential deleterious effects of companies not following the law. And I think that there should be a bigger push on
10 seconds.
On stronger regulations and making sure that these regulations are followed. But I think the potential effects of the potential positive effects of of those ethics outweigh that.
Thank you very much to both teams for a very lively debate.